This video is going to show you how to do a lower back massage or lumbar massage. Really good to include lumbar work with some glute work. So if you have a look at the glute video, even into hamstrings is really effective. And also combining lumbar massage with upper back, which I've got a half-an-hour video on as well. So if you can link those two, you've got a great 45-minute treatment for back massage. Just thinking about preparation, so the client's lying prone, we've got a bolster under the ankles to relax the legs, and for draping I'm going to tuck the top of the towel in. I've asked permission, and we need to come down to around this line here where you just see the top of the glutes. So if we tuck in, okay, and we just go down to that area here, so we see the top of the glutes. And I've already worked on the upper back, so I'm only exposing that area. It keeps the upper back warm as well. Start off, apply the lotion, warm it up in your hands. Again, I've got quite a low couch for this one because some techniques I'm going to be using my body weight. So just think, the lower the couch actually the better. And if you're starting off with massage, you tend to have it a little bit high and you'll be struggling up here. So already I need just a touch more. This is just applying the lotion. To start with, I'm going to use a technique, crisscross effleurage. So I'm going across the back. I'm touching on the top of the glutes, glute max, glute medius. And my pressure stroke goes away from the spine. What I mean by that is you'll get the stretch on the way down, and you don't want to use pressure on the way up because you tend to get the skin coming together here over the spine. So go outwards, lighter on the way up, pressure stroke on the way down. Lighter on the way up, more pressure on the way out. Okay, it feels nice. It's a way of applying the lotion. Today I'm using Naki sports massage lotion, which I find really effective. You need to apply it a few times, but it doesn't leave too much oiliness on the skin after the treatment. It absorbs in, and it's really good for moisturising as well. So that's my medium of choice. So we're doing this just to warm up the back. If you're a student training, you need to be thinking of the muscles that you're working on. So what are we covering when we do a lower back massage? Well, the biggest muscle that we're going to be working on is the latissimus dorsi. Latissimus means wide, dorsi means back. So the wide back muscle. So it comes from iliac crest. It comes from sacrum and coccyx, all the fascia. This area on any muscle post or muscle book will show as a white connective tissue, and the muscle comes right up here and attaches around, twists around and attaches onto the front of the humerus. So it's a huge muscle that we're going to be working on. For lower back massage, we're only working on this lower part of it. So next technique I could use could be a palmar kneading. So work down, leaning my body weight on. I like working away on the opposite side in the lower back. I find doing this technique on the near side is more of a push. I find it a little bit more awkward. So what I intend to do is work on the far side. And when I want to do this technique on this side, I would then put my hand on, keep contact and walk around. So I'm working on top of glutes. Above the iliac crest here, there's a ridge of bone that, again, putting a lot of pressure on that area can be quite tender. So above it, we've got a space, muscular space here before we get to the bottom rib. So my client here, bottom rib starts around this area, iliac crest is this area. So we've got that much space in between. But if you start doing deep techniques around the corner here, again, you're on the ribs. So that can be pretty tender. We want to stay away from deep pressure on the ribs here. So we've got palmar kneading. palmar circles, form of effleurage. Just get that area nice and warm. What we can do is get our forearm in and just work a little bit deeper. Gives your hands a rest as well. It's good to chop and change and use different body parts to work with. So for this one, I'm just going to use my forearm here, support with that one, and I'm going to slide up this way. So I am leaning over the client because my couch is low. If your couch is too high, you'll find you're not really getting in. So for that technique, you'll want to come round, or I would, number one, lower your couch for back treatments. So that's a forearm effleurage. Starting to see the reddening coming in, it feels warmer. As I say, always try and keep 2 hands on your client wherever possible. I see some people when they're starting doing this. It looks professional, it feels good. If you have a go on your client with 2 hands on and then you take 1 hand off, it actually feels like something's gone in it. It feels much better, much more grounded with 2 hands. I'm going to walk around the couch now just to do a little bit more on this side. So keep contact, walk around. Touch is very important. The moment you leave go of your client, they do wonder where you've gone. So where possible, try and keep that contact throughout the treatment. Okay, I can do a little bit of effleurage du poing around the top of the glutes. You might have already done a glute massage before you've done this. So that's interlinking the two, and they work really well together. Now, I talked about the space earlier, and I said around the top of the iliac crest and the bottom rib, there is a space, soft tissue space here. My client is quite tall, so the space here allows me to use a fist in that position. But if they're quite small or more petite, you might clip the bottom rib, so you could use that part of your fist and work in that space. Again, we can change it to open knuckles. And I use open knuckles a lot now instead of thumbs, because you've got 4 of them and you can keep your finger joint here nice and straight. And it does feel like you're getting a little bit more pressure. If they're really petite and you can't even do that, we can go with reinforced fingers, which might also feel a little bit deeper. So you can have a go at different positions and different ways to work in. We're working across the top of the glute maximus. We're working across the bottom of the lats, getting a bit of erector spinae. And then another muscle that I haven't mentioned so far is the quadratus lumborum. So the QL, as it's commonly known, is found from posterior iliac crest here up to bottom rib, and it will be where the erector spinae is. So spinous processes, erector spinae. You come across erector spinae and you can see, hopefully, that I sink in. I come around this solid muscle and I sink around the corner, and that is the QL. And the QL goes from here to here. So you can reinforce your thumbs. It normally feels quite tender to work on. This muscle is responsible for lateral flexion, side bending. Okay, so whether you've done any form of assessment at the start of the treatment with lower back pain, I often get my clients stood with their feet shoulder width apart and they try and lean over to one side. And if you do that on both sides where they feel the tightness, or you can do it via measuring, if you can work on the QL, it can help to improve range of movement and release this tightness. We can do the same thing, we can do it as a compression. So we can reinforce our thumbs, come over and in, watch this, come over, sink in there, press and hold. And again, if you're new to massage, you need to be using a lot more feedback. Because I've been working for 25 years, I tend to know what kind of pressure to use with clients. But when you're starting off, it's really important to gain that feedback. And the feedback you could ask for is a a pressure scale of 1 to 10, where 10 is unbearable, 1 you can't feel, and you want to be going into these areas maybe 7s or 8s, which is an uncomfortable but manageable pressure / pain. What you shouldn't ask clients is it okay? Because is it okay leads to the answer of yes, which doesn't give you any clue. And you might finish the treatment and they think, oh, I wish you could have worked a bit deeper. So watch your questioning, watch the client's body language. They will tense up, glutes will tense, verbal cues throughout the treatment. So I've done a little bit on QL here. I've done some general lower back work. As you can see, however long I've been working, I've only worked on one side of the back at the moment. So I'm going to apply a little bit more lotion, and I'm just going to repeat that and let you practice your techniques on the other side. So with my nice low couch, I'm warming up. I can go back to the crisscross effleurage. This one I'm using what's called a horse riding stance. Okay, where I'm going up and down on my knees, keeping my back straight, my elbow straight where possible. If the couch is too high, you're going to be up on your tiptoes. Move into effleurage, effleurage circles, palmar circles. And then to get a little bit deeper, we can go palmar kneading. So pick up, squeeze down, pick up, squeeze down. The towels will come up a bit. Let's get into the top of the glutes. Watch the top of that hip, the iliac crest here. And then we can go into that soft tissue space in the centre there. I didn't show you on the other side. Depending on the client's tone, we can just drop in here with a bit of an elbow, but we're not going too deep. It could feel a little bit more pressure than just using your palm. So we're working away this time. So we can carry on with the palmar kneading. Chop and change between all your techniques. I know with body massage courses or Swedish massage courses, they will teach you via 12 techniques followed by 6 techniques, and everyone's obsessed with how many techniques to do on each side. So with sports massage, it's more freestyle and it's more doing what you find as you're working. Good points about that is you can never go wrong if you haven't got a routine to follow. So but it's more intuition, it's more palpation skills and finding the tighter areas to work on. So from here, let's do some forearm effleurage. I'm going to lean over, and from there fix the hip, and I'm just going to work up with my forearm up the body. That's good. I'm going to walk around the couch now, so make sure you keep contact, hand on the body, walk around. I'm going to do some effleurage du poing, so I can do that on the top of the glutes here. So I say we might have already done a glute treatment, so this is combining that and adding it into your lower back. We can then go in that soft tissue space between the iliac crest and the bottom rib with my client on the couch. He's got quite a long back, so we've got plenty of space here, but if not, we can turn the hand around that way. You can go open knuckles, like so. Or we can go reinforced fingers that way. So you're pressing your fingers and we're going around, drawing a line around that iliac crest. Short nails are so important, because if you've got any nails at all doing this, you would just leave scratch marks. So you could wear gloves, but ideally we want to be filing our nails. Probably the more you massage, the quicker they grow, maybe every 2 days. Right, so I'm going to do a bit of effleurage du poing up the erector spinae here. You can see the trail marks I'm leaving. And then we can go on the QL. Do you remember what QL stands for and where it attaches? We've got quadratus lumborum from posterior iliac crest up to bottom rib and off transverse processes of T12 to L5. So we're finding erector spinae here, and then we're dropping off the muscle into, feels like an indentation, but it's just layers of muscle. So we're off erector spinae here, and we're going to be working from iliac crest up this direction to the bottom rib. We can go reinforced thumbs. We can use knuckles. We can use a combination. As I say, there's no one right technique. Depending on your joints and what you want to protect, you can choose what is safer, what feels better for you. We can even go there with an elbow, controlled elbow. A technique I like to use with my clients, because I do like having some interaction and my clients helping me to do some of the work as well, is using a posterior and anterior pelvic tilt. This might sound a bit complicated. My client knows what they're going to do. So if we can show what that is before we do any techniques, if we can arch here. Okay, so you can see the erector spinae contracting, and go the other way, push your hips into the couch, tightening up the glutes, brilliant, and back again. So that's great movement. While the client's doing that movement, we also want to be working. So when they shorten the muscle, I'm going to go with a controlled elbow, and my client pushes into the couch. This is our lengthening technique. And come back. As they lengthen, we do the technique up the couch this way. So we're both lengthening together. It's really, really good to get into these lower back areas. For lumbar pain, it's really good, and a bit of mobility as well. And then I would come around the couch, and I'm going to do the same on the other side, on this side. So arch for me, please. Arch here, and then slowly push your hips into the couch. That's great. Arch again. Some clients never get that movement. You can tell them 100 times to do it, and they don't have a clue what they're doing. If that's the case, just go straight with elbow stripping. But it is a movement everyone should be able to do, and it is great to give your lower back a nice stretch as well. So pelvic tilts are a really good exercise to do for disc problems and sciatica and tight lumbar area. So I'm finishing my lower back. There are lots of other different techniques we can do. We can do side lying, but I'm going to do those in further videos. So for this video, we'll combine it with upper back. That will make you a great at least 45 minutes on this area. So soothing off, and then always finish with a technique which shows you have finished. So I'm going to cover up, untuck, or else they'll get off the couch with a cape. And we go like so, and then I'm just going to have a little feel of that range. It also helps to wipe a bit of the lotion off. Okay, I like a bit of rocking as well. Rocking there just helps to relax the body. And then to finish, I'm just going to lean on and just do it as a last compression.